Hello, Miss Jackson. My name is McDonough, and I'll be your nurse today, and I'm here to give you your medication. Um, I perform my hand hygiene, apply hand sanitizer. I check my MAR to make sure that I have the right patient. Miss Jackson, can you tell me what your name is? Can you tell me your date of birth? Do you know where you are today? Okay. So today, Ms. Jackson, I'm here to give you your scheduled medication. One of your medication is a blood pressure medication, so I have to check your blood pressure before I give you your medication. Is that okay? Okay. So I check her blood pressure. Okay, Miss Jackson, your blood pressure is 140 over 90, which is a little high. So today I'm going to give you your blood pressure medication along with your other scheduled medications. I have a medication pack. I check my medication. I have my MARS open. I check her armband, make sure that, it's the right patient. Against my MAR and my doctor's orders in the computer in the EMR. And okay, are you taking your medication today? And she answered yes. So I checked the medications against the doctor's orders. I checked the dose. I checked the route. I checked the patient. I checked for the indication, which is what the medication is for. And I checked the date and time, make sure, right now is the time for her to be getting her medication. And afterwards, when I'm done, I will record her blood pressure, which I checked before giving her the medication, and record the time and the date that I gave each medication. Okay. Okay, today your medication that I will be giving you is milk of magnesia, your oxycodone, your methopritol, which is your high blood pressure medication, and Prilosec. Okay, so that's four medications that I'll be giving you. One is a liquid and three is in pill form. How would you like to take your medication today? I can give it to you with water, or I can give you the oxycodone. I can crush that for you and put it in some applesauce, or I can give it to you whole. Which would you prefer? She answered, okay. So first medication we're going to be doing is the milk of magnesia. So when you're measuring liquid medication, you have to make sure you put it on a flat surface and make sure that you pour the correct amount of medication. The oxycodone, the methopritol, and the Prilosec, I put in a separate container other than with the liquid medication. So I gave her medication. And then after you give her the medication with the high blood pressure, you probably want to wait about 30 minutes to an hour and come back and check her high blood pressure. Make sure that the medication is working. Also the oxycodone, check to make sure that she's not in the same amount of pain that she was before you administered the medication. And yeah, the milk of magnesia, later on during the shift, or you can report to another nurse to check to make sure that when and if she did have a bowel movement, because the milk of magnesia is for constipation. So you check to make sure that, she had a bowel movement and did she still, or she still currently experience constipation. So I gave her medication. You watch to make sure that the patient takes the medication. Or you record whether the patient took each medication, or did they refuse any of the medication that you're giving them. And I checked all of that. Now I'm documenting that my patient took her medication, the route that I gave her, and the time. And I think that's it. I have checked, knocked, introduced myself, checked the patient armband, checked my MAR. I checked the medication labels, make sure it's the right medication for the right patient. I asked the patient whether, they have the right to refuse. So I asked her if she wants to take her medication right now. The patient agreed. And I documented after I gave my patient medication, and then I will observe the response to the patient, what the response the patient had to each medication that I gave her.